Thank you, Kathy. As it is our practice, most of our meetings and our conferences and forums, and education sessions are begun with a land acknowledgement of ancestral lands. So I will begin reciting that statement. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe, and the indigenous people have a long-standing history and connection to the land since time immemorial, and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and US governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. Thank you very much for allowing me to read this. So today I have the pleasure of introducing our folks. So Annie Holland will be who is the MPHA Policy and Advocacy Co-Chair, will be moderating the session. We may be joined by Representative Ruth Richardson. We're not, since it's a legislative session, we're not totally sure if she'll be able to join us, but looking forward to her presence. And today I also have the honor and the pleasure of saying that Vayong Moua is our keynote speaker here, our messenger. He's a director of racial and health equity advocacy. If you registered through our website, you saw his bio, but I just wanted to say that I have admired Vayong since I met him in early 2000 when I was at Clearway, Minnesota. And Vayong had begun working with Blue Cross and Blue Shield. He is an amazing advocate who has, I think, shaped a lot of the policy and equity work at Blue Cross Blue Shield and has impacted many systems across the state. I am proud to say that he was also the fellow with the LAMP Institute, the Leadership and Advocacy Institute to advance Minnesota's parity for priority populations, and he's currently a Bush Fellow. So that is our who we're having a discussion with today. So I welcome Vayong, a long time friend and colleague.
Thank you so much, Jaime. So this is Annie Holland speaking, and I just need to check in. Are you seeing a box in front of the slide?
No.
Okay, good. So I was.
Annie, I think you're muted there, but would you like me to go ahead and launch the first poll?
There we go. Yes, please. So we are just wanting to kind of get a sense for where folks are at here with this poll. And of course, we're kind of self-selecting for this topic. So, but just kind of wanting to see where folks are right now, and that will kind of help inform our discussion. So we can maybe give it a few more seconds. Okay, so it looks like most folks have voted, and not a huge surprise. Most are strongly in agreement that racism is a public health crisis. So that kind of helps gets us kicked off, and thank you for taking that poll. we are just going to launch into some questions now and have a discussion, and then we'll have a bit of time at the end for Q&A. I do want to just, touch on that. Of course, right now we're having this conversation in the midst of again, more very painful display of racism in Minnesota, with the killing of Daunte Wright, and now expecting a verdict soon on the Derek Chauvin trial. So of course, again, it's so top of mind, and emotions are really running strong, and there's so much sadness and grief in the community. So there's a lot of weight and heavy feelings. And there's also a legislative session that is still in progress. And we wanted to sort of touch on Minnesota state legislation as well. So we've seen a lot of very public, police violence and racism playing out in that way. But of course, we've also seen over the last year disproportionate impacts of COVID, and now disproportionate vaccine distribution for people of color. So all of those things are kind of swirling around us. And so we really appreciate your time, Vayong, and knowing that this is an extremely busy time, and there's so much work to be done. And as an advocate on anti-racism and public health work, there's a lot of work going on at this moment. So I'm wondering, the first question I wanted to kind of start mulling is, what is the state of the group that's meeting with the governor to declare racism as a public health crisis? I know the House has done that, but I know there's also some talk, probably not very well publicized, so maybe folks don't know much about it. So if you could just tell us a little bit about that work and what's the status of that at this moment.
Sure. Thank you for having me and for prioritizing anti-racism within public health advocacy. There's a lot of thanks to be given to the organizers and to those who set this up behind the scenes. And perhaps before diving into the specific question, if I can just riff off some of the broader themes, because the complexity of the moment, the heartache that is happening here in Minnesota, I think just warrants a little bit more airtime. I think it's not lost on any of us that Minnesota has become the epicenter for racial injustice, and I would argue that was a unfortunate title that even preceded the murder of George Floyd. Right. And I think all the injustices that we're seeing, from Daunte Wright's killing to George Floyd to the rise in anti-Asian racism, not the beginning of it, but just the increase and rise of it. And all the inequities that we saw in commercial tobacco use and diabetes. And so I think there's a need for us to recognize the inequities in all the slow deaths and chronic disease, and connecting that to even further upstream to the inequities in housing and employment and insurance coverage, and obviously in our criminal and justice system as well. And so I just want to make sure that as we enter this space and we're talking about a variety of policy priorities and approaches, that we're well situated in understanding the pervasive patterns that have preceded us too. And thank you, Jaime, for the kind introduction. Something that may not jump out in my bio is the important influence of my parents. And I want you all to know kind of my origin story, if you will. And in a short amount of time, I just want you all to know that my mother worked in the Eau Claire Public Health Department for over 25 years. She was the equivalent of what you would call a community health worker today. And my father worked at City Hall in the mayor's office and helped Hmong refugees resettle and helped our city system adapt and become more culturally competent and capable as well. So I'm really the outcome of both, I would say, civic engagement and public health. And those are two shaping forces. So sorry for the long introduction there, but I just want to give you a sense of kind of how I'm entering this space and place today. To your question about the state action team on racism as a public health crisis, I really want to make sure we give props to Representative Ruth Richardson. And as you all know, this last summer, the Minnesota House passed HR 1 declaring racism as a public health crisis. And in that resolution, if you haven't perused it, I would strongly encourage you to read it, sit with it, struggle with it, and internalize what that means for yourself personally, for your organization. One thing that I want to lift up in HR 1, and I know that Representative Richardson may or may not join us. I'm just hoping for a surprise cameo appearance by her. But one thing I want to lift up of significance is that it established the House Select Committee on Racial Justice. So in addition to calling attention to the forces, historical and contemporary forces that have created these racial and health inequities, it really transformed the legislative process itself. So the formation of this committee, which has a set of robust recommendations, which I believe MPHA did a great summary of too, and please look at that when you have a chance. But I wanted to highlight this because what it did was it embedded racial and intersectional equity analysis, not only into one bill or one decision, but into the legislative process within the House. And I think that is a great template for how we can build racial and health equity into policymaking, into governance, and certainly applying to specific issues like food security or commercial tobacco control or COVID-19. But I wanted you all to understand the significance of this resolution, because it wasn't just we understand and we're declaring something. We're actually trying to transform the way we consider, analyze, and do policymaking in Minnesota. Now, the goal, I think, is to make sure that's a permanent committee and making sure that there's a bicameral counterpart in the Senate and even built into the Waltz-Flanagan administration. But nonetheless, the racial and intersectional impact analysis is the template that we want to scale up, apply, tailor, and embed in all key decision-making processes. And if I'm going too slow, I need to zoom in and zoom out, please help me navigate. My disclaimer always is I come from an oral tradition. The Hmong written language was only about 50 years. And so that's my all-time disclaimer if I'm veering off track here. To your specific question, we have been pressing Governor Waltz's office to not only declare racism as a public health crisis, and CDC has done this, many states have done this, many cities and counties has done this, MPHA, Blue Cross, many organizations has done this. And we have been clamoring for the Waltz-Flanagan administration to do this and to go further to operationalize that. So once you recognize racism as a public health crisis, what does that mean for how you budget and how you assess state agency budgets? What does that mean for how you review bills? What does that mean for the structure of your leadership team? Who and what kind of capabilities is on your leadership team? What does it mean for the way you engage communities that are experiencing racism and other inequities? And so we want to make sure that certainly the recognition is profound in itself, not because of what the recognition is, but from who is it coming from, the source of it. Our communities who face racism, this is profoundly obvious. They don't, they don't need the state to tell them that structural racism is real and that racism is a public health crisis. But the political cover, the scientific cover and credibility is what can allow advocates to really build upon that recognition with policy systems and environmental change. And so I want to give you the origin of this action team really is rooted in advocates wanting to build upon HR 1. I want to make sure that that recognition was transferred to the administration and built into all of the state agencies' core functions: contracting, procurement, hiring, retention, and obviously apply to important issue areas like food security and housing and employment and COVID-19 and on and on. But I wanted you to have a sense of like the energy that shaped the calling for the state action team. And so Jaime and I just actually joined a meeting. It was the second or third meeting. It's all a blur right now. Earlier in the week, and Commissioner Harpstead has joined us at the cabinet level. Nathan Chomolo, who some of you know, has joined it, and it's a good cross section of public and private, cross-cultural and interdisciplinary leaders, really pushing the question of the importance of declaration, the necessity of that, and then also making sure that we don't reside only at that level of recognition. And so I would call upon this whole audience to help us define what that action looks like in terms of public health. What does that look like? So you see as a public health crisis, how does that recognition then materialize into investments and action steps? And so it is at a formative stage. And my affectionate criticism is that we are still way behind. There's still some building blocks that are set in place. I am underwhelmed at the effort so far, but I think there's a rising healthy tension and conflict in the group to move towards substantive action without bypassing critical building blocks around trust, reconciliation, and long-term investments. So I'm happy to share more about the charge and scope of this group. It is still candidly being written and rewritten. And Jaime has a direct link into this group as well. And so we will depend on your leadership and perspectives to refine that work and to make sure it's actionable. Maybe the last thing I should mention about this is just so you have a sense of where the state action team resides. It is functioning as a subcommittee of the One Minnesota Council, which is the cabinet that is charged with advancing inclusion and equity. And if in case you haven't been tracking, Executive Order 1, Governor Walz's first executive order was on equity, diversity, and inclusion. And he had just recently amended that executive order to formulate the Council of Inclusion and Equity. And that council is charged with this administration-wide operations around inclusion and equity. And so you all have a sense of how the state action team is feeding up into the governance structure around inclusion and equity. So happy to share more detail or zoom up. So I want to give you a sense of that.
Yeah, I think that's good for now. And I know that some folks have asked some questions and gotten some responses already about where to find certain things that you just discussed. And I do think one person's question, I just want to make sure that it's clear that the House Select Committee on Racial Justice was a temporary committee, right? I don't know what the technical term was, but so it's completed its mission, but it did also create a report, right, and made recommendations. And those I think are a nice guidebook as well for looking towards some anti-racism policies. And I'm wondering if you agree with that statement and if there are certain parts of that report or recommendations that came out of that you have noticed, if any of those have gotten traction. Yeah, if you wanted to just, and I see that maybe before we step into that next question, that there was a question about if you could say more about feeling underwhelmed with that action team. Is there anything in particular that you would like to see to improve or change?
Yeah, and I share this, so I'm not talking behind the state's back. I share this directly with Chris Taylor and Ku Tao and many of the leaders who are inside champions fighting the good fight. But I think there's I think there was a deliberate approach to build team agreements and just foundational values and how we approach this work, which I think you cannot bypass. That's in many ways, that's what has created these inequities, that we just taken them as assumptions. But I think we're also in a place where we have more than enough information, more than enough science, and that the challenges in front of us are around political determinants of health. And I don't mean partisan political, I mean power, the ability to create change, information, right? Privilege. And so I think there's just a real sense of urgency to act in a meaningful and substantive way without, again, overlooking key building blocks. And so I think we know what needs to be done. And it's a lot of that is building in racial and intersectional equity analysis and praxis into policies and procedures. And I think there's this is a healthy tension to have in this discussion too, is the balance between transforming hearts, minds, and structures. And I'm of the school of thought that I lean heavily towards the structural piece, but in a way that doesn't minimize the importance of nurturing and cultivating understanding and education. Similar to public health, we cannot do health fairs and just hand out cookbooks and pedometers and say this, we're gonna solve a lot of public health issues. Same with structural racism, right? We cannot solve a way through trainings, through multicultural potlucks and book clubs, right? We're gonna have to change policies and systems and environments, very similar to the SHIP model, the socio-ecological model. And the last thing I'll say about this is when we have studied the anatomy of all the great social movements, whether it's civil rights, the environmental justice movement, women's rights, then none of them really relied on a Robert Wood Johnson Foundation, a Clearway Minnesota, or a Blue Cross, or Melinda Gates. There's a famous phrase in philanthropy: the revolution won't be funded, right? And it's not to say we don't need material resources. It's that a lot of what we know needs to happen cannot be contingent on racial equity enlightenment alone, right? We've been waiting for over 400 years, right? And so I think we have to take the position of whether you believe it or not, whether you're drawn by racial justice or by the bottom line, that we need to make sure that we're going to hold organizations, institutions, the state, health plans accountable for inequitable impacts. So I think that speaks a little bit to the discontent that I had, and it's respectful, but it's also impatient too. So.
Well, and as you mentioned, 400 years, so that's a long time to be waiting and actively working. So I do think I want to return to my next question then about kind of where you're seeing current status. If you are feeling there's any legislation that does have some momentum, have some legs, whether it was something that came out of that recommendation from the select committee or just something that you've been following as an equity advocate.
Yeah, I had a chance to testify in the Select House Committee on this very matter, and I've had a chance to reread and review the report that came out, and it's quite a monumental report. I think if you haven't had a chance to, again, go back, and they have wide sweeping recommendations that cover economics, housing, health and human services. I don't think I'll spend time on lifting up specific issues, but one thing that I told Representative Moran and Representative Richardson, both directly in the hearing and then more so extensively all offline, is to really build in racial and intersectional equity into the governance structure, into how are we reviewing all bills. Why isn't there a permanent committee on this? Why don't we have an anti-racist cabinet? we have a children's cabinet, right, in the governor's administration. And so we're going to prioritize racism as a public health crisis. Let's see that in governance so that every issue, there's nothing that is exempt from anti-racism action and application. So they're pretty broad in that. I was pretty broad in that recommendation. There is a few bills that I would like to lift up, though. I'm not sure if it's captured in the House report, but there's a bill that has been introduced by Representative Samantha Vang, and it's basically to create an equity note. It's challenging the formulation of a fiscal note, and I can send you the link and all that. I believe it's House File 2297, and it's requiring an equity analysis into the fiscal note, in which those of you not familiar with that is basically a price tag for a bill, right? And it's usually done from a cost benefit analysis. And equity has always been at best treated as an amenity, right? And so we're trying to make sure that as bills are being assessed, that they're not just assessed from a financial standpoint, but from a racial and intersectional equity standpoint. And so Voices for Racial Justice, the Center for Social Inclusion, have been strong champions and leaders in that. And so I'm really intrigued by this because it not only can affect specific issue areas, it's trying to impact everything that is considered within the legislative process. The other bill I should lift up is Representative Rena Moran was the original author for the formation of the Cultural and Ethnic Communities Leadership Council, which provided equity policy recommendations to DHS, which to just remind us all, DHS is about 40% of our state budget. It fluctuates between 35 and 40. So, I mean, that's huge. I don't really know what MDH is. I forget how big their slice is, but it's not even close to that. Maybe it might be in single digits. And so DHS covers virtually every determinant of health. And so I just wanted to lift up the importance of this council. The bill was to eliminate the sunset date for this council. And I think councils all have, there's some fair criticism because councils can be treated as tokens and just, a fancy like focus group. The CECLC, though, was set up in statute and is cross-cultural, interfaith, and cross-sector. And it has a lot of political and community power built into it. And I believe that it can be a template for how other state agencies, the administration, can engage with and draw upon the leadership of communities, not just their vice or selective input. So I want to lift that up as well. And then maybe in the interest of time, I'll just mention the COVID equity bill, House File 2113, which really supported, there's a few significant things, but one, it created a COVID equity director role. And Nathan Chomolo actually has rotated into that role and is sharing his Medicaid director role at DHS too. But we really wanted to make sure that, again, racial and health equity was built into governance, into the oversight of the vaccine distribution committee, and that it wasn't just a consideration built in along the way. The other key component of that bill was to support mobile vaccines and to disaggregate data as well. So the COVID equity bill is worth mentioning as well. And I just want to be mindful as I lift up various bills to pay attention to. Perhaps even more important than that is to discuss and highlight the importance of racial and health equity into policy advocacy, upstream of what gets written into legislation, upstream of what gets written or how a bill is analyzed. But from my experience, I've worked on smoke-free campaigns. I worked on the Good Food Access campaigns. I've worked on I helped found and pass the state Complete Streets Law, active and equitable transportation. So I've had the privilege of working deep on specific issues, and the epiphany I have in all these various public policy campaigns has been the inequities within advocacy itself, right? So when you examine who are the policymakers, who are the lobbyists, who are the community organizers, who are the coalitions, the pattern I've seen is that racial and health equity has been treated as a amenity. It has always been conceded during political crunch time. It was never treated as the central top priority. And earlier we did a poll of this group, and Blue Cross did a statewide poll. And there's a couple questions I want to bring to your attention. We asked all Minnesotans, is racism a significant problem in this state, in Minnesota? 80% of Black, Latinx, Indigenous, and Asian Pacific Islanders said it was. 42% of white Minnesotans said racism is a significant problem. So that's a huge difference in how our communities experience and prioritize racism. And just to be really direct, 42% of the creators and perpetrators of racism think it's a significant problem. And 80% of the communities who suffer and experience racism think it is. The other stat I'll throw out there, similar to our polls, 2/3 of Black, Latinx, Indigenous, Asian Pacific Islanders believe that racism is a public health crisis. 2/3. 57% of white Minnesotans believe that racism is not a public health crisis. So maybe this is profoundly obvious to this group, but the way I see that, the way I interpret that is there are inequities in priorities. In how do we deem what matters, what's important? And if that's the public sentiment, how does that translate when you do the power overlay? How does that translate into a budget, a personnel plan, a strategic plan, an association recruitment plan, right? Whether you're at the legislature or you're in a foundation or a nonprofit or business, these are just broad sentiments, but you can imagine how that translates into how organizations set their priorities. If we have such variance, contrasting sets of priorities. And so I know that seems really intuitive and obvious, but if anything, it's just a confirmation of Minnesota's public and public health crisis. And so I wanted to, as we lift up specific bills that are addressing racism and are anti-racist, that we also see them in the context of how are they being fought for, how is support being garnered to pass them.
So just to piggyback on that, I know I saw a question in the chat about, what are some actions we could take right now on racial justice. So I'm wondering if, and certainly MPHA, will be in touch and will be sending out, action alerts as piece-specific actions come up and arise, and anything related to the action team that you referenced as well as that takes shape, and there may be some activities going on related to that. But I'm wondering if, you mentioned a few specific bills, but is it worthwhile even just to kind of start that conversation with a legislator or anyone really holding power? I suppose it could be also someone in a position of power within your own organization, to let them know how important racial justice is to you, and how you see the connection between health and racial injustices as being the most crucial topic that we need to be addressing right now. Is that sort of, conveying that message to people in positions of power? Is that something that you see as an effective use of your time?
Well, absolutely. I would just balance that with connecting with community members and community leaders that are experiencing racism and the racial inequities, and so that you can be megaphones for communities and not just speaking in alliance with them. And we all know that true allies are, that's not a, you can't self-proclaim that, right? That's only a title that can be given to you from communities that actually experience structural racism and structural inequities. And so I would just balance influencing and applying your power with other decision makers, but making sure that it's in connection and in solidarity with communities that experience it. I'm reminded of a resource I should send you all if you haven't seen it, but Voices for Healthy Kids, which is the National Heart Association's focus on childhood obesity and increasingly racial and health inequities. They created a message guide for public health advocates on how to position and advance racial and health equity with policymakers, specifically legislators. And it's assessing for different levels of readiness, whether they'll never be moved by it or that they're, that's why they ran for office. So I'll send you that as a resource guide to help us with the framing and the lexicon around racial and health equity. But yeah, I think it should be applied to every issue. If you're pushing for sugary drinks tax or eliminating commercial tobacco control products, or trying to strengthen SNAP utilization, or getting equitable COVID distribution, whatever it is, there is a strong link. I guarantee you there's a strong link to racial and health inequities. And so it just needs to be applied and tailored to all the issues you do.
Thank you. That's really helpful. I do think, and there was a note that Alyssa Fritz put in the chat here about Representative Vang's equity note bill, and it looks like it didn't make it into the Senate bill. So that might be something that MPHA could advocate for final budget negotiations. So just to briefly kind of get into the weeds about where we are at currently with the legislative session. So the omnibus bills have come out, right? So we're at the point where we are in the final budget negotiations where I don't know, to me it feels especially wonky where it's in closed door, where it feels like there's mostly activity happening behind closed doors. So it feels especially challenging at this point in the session to influence things, but certainly we can add that to our list for advocacy.
Yeah. I mean, you may have seen in the House Select, the recommendations, they supported CDC's recommendation of $53 million for comprehensive tobacco control. There's a lot of things that public health has consistently advocated for. And with the equity note, I don't know if that was in the report or not, but to me, it really represents this evolutionary approach to policy advocacy and to public health. And even if it's not going to make the final cut this year, I think it's something that all of us as a field can begin rallying around and start supporting, because it's been a similar version of that bill was introduced by Senator Hayden and Thiessen back a few years ago, and so it's going to take a while to saturate into the public discourse and to get the political traction that it warrants. To your point, though, I think maybe more important than just supporting, again, this single bill is to begin developing a strong and meaningful connection with a posse caucus. This is the People of Color Indigenous Caucus at our state legislature. And it's just really essential to have real relationships and not just supporting bills that they author here and there, but like this is, believe it or not, this is the most culturally diverse legislature we've ever had. I think we're up to 25 legislators of color and indigenous self-identified. And just back in 2013, there was only 7 legislators of color and indigenous. So that's quite the exponential growth. There's an interesting graph. I can send it to you all after or during this call, that just to give you the visual of how much we've changed. And there's a Black United Caucus, there's the MAP Caucus, Minnesota Asian Pacific Caucus, and then there's the Combined Policy Caucus. And so if you're looking for ways to strengthen anti-racism in your advocacy, there are some real champions at the legislature. And I think organizing with their respective agendas and applying public health to what they're fighting for would be great. The example I would bring up is that I recall the Policy Caucus just a couple years ago, they released their policy agenda. And most of it went towards deed and education. And that's not to minimize the importance of deed and education, but there are very few policy recommendations that supported public health or health and human services. There might have been 1 or 2 items in DHS's budget, but it was astounding to me that there wasn't an explicit and strong and consistent connection to what the Policy Caucus was fighting for and what would impact public health. And so I think there's room to grow and connections to be had so that the Policy Caucus can see very clearly the importance of racial equity to public health.
Well, I do think, one thing too that I'm curious about, and I think as we were preparing for this session, you mentioned something that's really stuck with me. And I saw there was a sort of a question about this in the chat. There was a question about kind of, is it time maybe for some public health advocates to step out of an advocacy role and to think of ourselves more as activists? And I don't know necessarily, what that means, but I have to say, I think I feel that tension myself as I was preparing the slides, and I added on the last slide a quote from Angela Davis that was about activism. And I thought, are we activists? I think there's some tension there, and so I'm wondering if you could comment on that, and then also comment, if you can, about that I think you've expressed, and I have as well, felt some pushback on working explicitly on racial justice as a structural issue, when really public health is all about, policy systems and environmental change. There seems to be a little bit of a block for some folks to really embrace racial equity as a structural issue that should be dismantled, just like any other structural issue that's leading to public health problems. So I'm wondering if you comment on that.
Yeah, there's a lot there to unpackage. When I joined Blue Cross back in 2005, the state smoke-free law hasn't passed yet. And my first few weeks on the job, I was at Hennepin County, and there's great debate on a smoke-free policy. And many of the folks who testified were not so-called activists. It was local public health. Public health was always at the table at the state legislature, at the board of county commissioners and city halls. So they were right in there presenting the science, right? And it was like, it wasn't seen as being partisan. It was seen as, well, no, it's my job as a public health professional to tell you what is happening, right? And so it was definitely seen as core to their duties, their professional duties to participate in policy change. And so I feel like we may need to remind ourselves again to get in the arena and to make sure, it's kind of a cheesy cliche, but if you're not at the table, you're going to be on the menu, right? And so to make sure that you are part of that process, that you're presenting scientific credibility, and that you're acting upon the knowledge and information that you have. And so I think that's one response I would have to what you're saying. And I'm also reminded of just the framing of this time, right? Anti-racism, right? That term has a lot of different meanings. And what I appreciate about anti-racism is that it is active action, bold opposition that is really trying to interrogate this sense of neutrality, this false sense of neutrality, right? That you cannot just be, part of a white nationalist group and wearing a white hoodie and running around with a burning cross. That's not the only form of racism, right? And I can send you all. There's a great report on how structural racism has permeated public health. And I'll send you a link on it, but and it's really riffing off the themes of Dr. King's A Letter from a Birmingham Jail, where he talks about the dangers and the impacts of the white moderate that has perpetuated and been complicit. So I just want to again lift up the terminology anti-racism. By definition is to actively oppose it. So that's something I wanted to bring up. And then the other, you brought up about the tension between working on structural change versus or in addition to policy systems and environmental change. I think they're all very interconnected, right? And I would just say this, that if public health can take on commercial tobacco use, diabetes, and COVID-19 from this like ecological approach, right? Where we're not just trying to educate only, we're trying to change social norms and change policies. Because we know that the root problem isn't just individualism, right? And the same thing applies with racism. We know that there's personal, interpersonal, organizational, and structural racism. And we shouldn't let any level off the hook. But racism isn't just about like somebody calling me a name or telling me to go back to my country. I can deal with the drive-by racists and the racial slurs in my neighborhood or somebody walking by. But if they're impacting billions of dollars and key strategies and priorities for a school district, for land use in my neighborhood, for public health funding, right? Then I think that's where the real danger and impact can be. So I think we need to do better to make sure that we take both a structural and quantum approach to racial and health equity, that it's in your daily practice, it's how you connect with people who experience racism, how you build power, who do you build that with, and then the policies in which you pursue and try to embed racial and health equity within that too. So it has to be ecological in its approach. Otherwise, you just have a structural approach that is hollow and a mechanical approach. Or you may have profound, deep impact, but it doesn't have any staying power or isn't locked into any kind of power mechanism. So sorry, that's a long answer to your question there, but I wanted to cover that.
No, I asked you a pretty meaty question right at the end. I kind of slipped that through. Well, thank you so much. I know we had intended to leave chat for the end, but it just kind of naturally we ended up weaving it in our conversation. We do have one more poll. So Mary, if you don't mind pulling that up now for folks. The next question is, and I don't see it yet, but wanting to gauge about kind of different topic areas. And this is selfishly, I think MPHA is curious to hear, which of different topics that sort of exist in that realm of anti-racism work are people most passionate about or engaged in at this point. And I know it's, as I was making this list, I thought, oh, I'm making people choose between some, really critical work, but just thought it would be helpful to kind of get a sense for where people are at in terms of what they're following. So thank you for participating in that. And thank you so much, Vayong. I really appreciate, again, your time and your expertise and your passion that you bring to this, and such a thoughtful discussion and response from you. Thank you. So as we're just waiting for this poll to close up, looks like a few folks have yet to participate. So as we're doing that, I'll just mention that the Minnesota Public Health Association, please join if you're not already a member. And then if you are, please engage with our committees. We do have monthly meetings, and that's a great time to get involved, learn more about what's going on, and to help shape what we're doing as well. So I listed the meeting times and the emails to contact the different co-chairs. I do really want to just say that we have really already, we've got some great engaged volunteers, but always use more. And so I think we've had the poll open for a bit now, and almost pretty decent amount of folks have participated. So I think Mary can probably close that in the next few seconds. So yeah, I mean, across the board, it does look like maternal and child health, reducing those disparities is of importance, and that kind of looks like it edged out the others, equity and state funding, and maybe some of your comments today helped move that a little bit, Vayong, but I do think, yeah, that speaks to some of the structural building, that the structure around equity and how that can ripple out and have impacts across the board. That's great. Thanks so much, everyone, for participating. And then just again to also kind of echo Vayong's note about the theme for today, we're really picked up the theme from our conference, which is April 29th and 30th. So please register if you're not already. But yeah, engaging in anti-racism for public health is really key to our work. And we're going to have some great speakers and some great, it's spread out over two half days. So hopefully folks can make that work within your schedules. And then we also have our final policy forum, which is moderated by Ed Ellinger, a past president for MPHA and past commissioner of health. And, again, really justice oriented. So this theme is environmental health, is there justice for all in our public health response? So please join for that. And then that aforementioned quote from Angela Davis. And I do think, for many folks, I think the reason I was attracted to public health as a profession is the social justice and activism lean to it. But I do think there is ongoing tension between sort of, being a scientist and not, claiming to have any sort of skin in the game, but also really having that passion around making change to make for healthy conditions for everyone. So I just thought this was nice because it kind of reminded me that, what's great about working together is we're not just focusing on ourselves as individuals, but we're part of an ongoing historical movement. And I don't know about you all, but I really feel like we are living in very much historical times right now, and we're doing it together, especially when we're taking steps to reduce impacts of racism. So thank you, everyone, and looking forward to see you all at the conference.
Thank you, Vayong.
Thank you, everyone. Thank you.
Thanks, Jaime and Vayong.